So we can probably ask every single patient how they felt, and this is the introduction I always give to them. I say, if you think it's going to be hard after surgery at the rehab center there, multiply by 5. And they always laugh.
Yeah.
And they always laugh. They always make the jokes out of this. And then when they go there, the first text message that I get from them is, Marius, you were right. It's a torture.
Yeah.
But when they come back here, they said, there's no way
Yeah.
I was able to do this by myself. I didn't know how much I can push. I didn't know, how far I can go with certain things and whatever.
Yeah.
What's the biggest difference now that you're familiar with the Lithuanian rehab system and Canadian system, or North American?
Well,
probably?
yeah, and I think it's North American. It doesn't matter whether you go in North America. And I think for the most part, you're sent home from the hospital after your surgery with usually the only physio they get in the hospital is they'll get you up walking. They may get you doing stairs, usually as a clearance to go home. But there isn't much in the way of intensive rehab in the hospital or after you get a booklet and do the exercises. But we typically see them at 2 weeks post when they come in to get sutures out or staples out or check on it. And they haven't done very much of anything. They're usually walking with a walker or crutches. They're tentative in terms of what they can do. And it gets harder the longer that they wait to get started to reactivate muscles again, to get those joints moving and to get them free. And so the biggest difference on that coming back from Lithuania, particularly in this program as compared to some of the others, is that they're used to doing that. This isn't an issue. And now I just need to guide them on their next steps as opposed to starting to get them move again.
So if you're going to compare, because you do see patients who are done here locally, if you have to compare the ones that they come back from Lithuania and then the ones that you see, let's say 7-10 days after surgery here, what's the difference? Is there any difference or?
Well, there is when I see them for sure. At the same week mark post-surgery, the Lithuania patients tend to be 2 weeks to a month ahead of where the local ones are. And I think it's mostly because of that rehab side. There's far less complications in terms of range of motion and other pieces because that's aggressively dealt with right from the start. Whether it's the continuous passive motion, whether it's twice-a-day physio, whether it's the compression cuffs or other pieces to it, they're getting that range of motion coming from Lithuania. Whereas here it's a hope and a prayer, I think in some respects, that they're going to get that, or a comment that we hear sometimes, well, it'll eventually get better. And the way I always look at it is that we have, I call it a plastic period for about 6 to 8 weeks after surgery to get the joint moving. And if it's not moving by that 6 to 8 week mark, it's frozen in there. It's hard to get it moving. And so we've got to get aggressive at the start to get it moving.
So as a specialist, there's many Facebook groups where people go and share. A lot of patients, particularly after knee replacement surgeries, they tell that the surgeon or whoever else they've seen, they told them to start the physio rehab process 4 to 6 weeks after their surgery. What would be your suggestion? What would be your answer to that?
Sooner the better. Certainly at 2 weeks is when they get their sutures out. It's a natural point to do that. But really, for the best results, the sooner they can get into an active rehab program, the sutures or staples aren't going to stop them from doing that.
Can someone start the rehab right after surgery?
Absolutely, they can. We know that from Lithuania.